Here's how to use a nasal spray properly. I'm a board-certified allergist. I talk about this all the time with my patients. If you want to learn more about allergies, asthma, and immunology, hit that follow button for more information. Here I have Azilastine, which is a nasal antihistamine similar to Claritin, Zyrtec, and Zysol or Allegra, but it goes directly to the nose. It's now over-the-counter called Astapro, but it's also prescribed as a generic as well, so you should check the pricing based on your insurance to see which is cheaper. This nasal spray is not quite as good as a steroid such as Flonase or Nasacort or Nasonex, but it does a pretty good job and works more quickly than those steroids, so this is something that can be prescribed by physicians and can be very helpful. The problem with this spray is it can be very bitter, and so if you don't take it properly, it may not work as well, but also you could taste it and it could be really, really nauseating. So there's actually two covers on here. There's the top part where your nose goes in, but also there's a little spacer that you have to take off. And whenever you use a new spray, you actually have to prime it a couple of times. This one's already been pre-primed. And so keep in mind, people often will just point the spray in any type of direction, but it's really important to put it in the right way to reduce the chances of nosebleeds or tasting it. Because if you taste it, you waste it. All right, so nose looks down, nose to toes. When I place this nozzle, I'm not putting it in the middle, I'm not putting it straight and up and down. I'm actually going to tilt it slightly towards the ear on the same side, right here, okay? Now, I'm going to spray once on each side and then twice, because as an adult, it's 2 sprays per nostril. And then I'm not going to do this, but I'm just going to breathe normally, a lot of it through my mouth. Sometimes it may drip out the front, but you'll see me move my head back and forth so that it doesn't get into my throat and it minimizes the amount of dripping. So here we go again, nose to toes, point it up, tilt it slightly out. Tilt the head back, forward, breathe normally, and that's it. This type of nasal spray technique works for other nasal sprays as well. If you have further questions, let me know in the comments section, and have a great day.